Okay, so that's interesting. So, so you really were leading a pretty normal,
very normal,
impressive
ordinary
life, but a pretty normal life.
Correct. Very anonymous. You know, when they were clapping, the, healthcare workers for going in at night, I was just one of those anonymous people in blue, like in the PPE, just doing my job, I thought, taking care of sick people. But I was excited, to be honest with you. I'm an ER doctor. This is an emergency.
Yeah, right.
Bring it, So I was reading all of the journals. I was reading all the science, and I'm talking to my peers. I'm saying, what do you think of this? What do you think of this? There was such a lack of curiosity. It was shocking. I never knew that doctors were not curious as I was. It was the minority of doctors that were curious. And that
I thought science is curiosity.
No, it was dead. It was a very small minority of doctors that were curious, that were really, I'd be like, well, what do you think of this study? There was so many studies showing early treatment work. Their studies started in February of 2020. Studies came up from France. By July, when I came to national attention, there were 57 studies showing that the early treatment worked, 57 from all over the world. So I'd be showing people these studies, and the doctors were not curious. And it was, but not the good thing, but it taught me that the answer was never going to come through the doctors. The answer had to come from the people. That's what I learned in the first few months of the lockdown.
But by this point, you're like a long-established practicing doctor.
Correct. I was being, the doctors have become overwhelmingly employees, right? Doctors used to be small business owners and had some independence. I think in my father's day, it was probably about 20% of doctors, perhaps, were employees, probably less. Nowadays, I think it's around 75 or 85% of doctors are employees. So I was an employee of a hospital, as many doctors are. We were told what to do. So I think that contributed to the lack of curiosity.
Fascinating.
Your employer told you, you did it.
That's really, really interesting. But I thought the basic precept of medicine, which is of course the same as science, because it is a science, was that you don't trust any preconception about anything.
Right. So let me share something very, very interesting that I lived through as a practicing doctor. So initially, before hydroxychloroquine was so tarnished, people were quite neutral about it. And I said, look at this study from France, from Marseille, what do you think about this? And people shrugged their shoulders. Then Trump happens to mention it at a press conference. The next day, just, all heck broke loose. And in my hospital, I asked my peers again, like, oh no, can't use that. That stuff's dangerous. I said, really, what changed from last week when we had this conversation? The only thing that changed was press conferences. A few weeks later...
And not peer-reviewed press conferences either.
A few weeks later, there was an EUA allowing us to use it again. And I asked my peers again, what do you think?
Emergency use authorization.
Emergency use authorization. And my peers said, oh, it's fine now. I said, really? Because what changed? Did you read a new study? Like, why are you changing your mind? Doctors flipped back and forth based upon what they were being told at the coronavirus task force meetings and what they heard on Facebook. This was game-changing news for me. I had no idea that doctors were not thinking for themselves. It's very, very concerning.
Well, it's just so interesting, though, that you had lived in that world for decades and didn't know that.
Had no idea. I made decisions, as I thought most doctors did, based on your education and experience, and then when you ran into a clinical situation you didn't understand, you'd ask a smarter doctor. You'd say, that guy, he's a really good doctor, let me ask him, and then I'd read about it. Out the window. Another example, we never talked, in my whole career, you never thought about what did the CDC say. That wasn't a thing. I mean, maybe lay people did, but it wasn't a thing to doctors. I just want to share that with you. Like that, we didn't say, oh, the CDC says this. I find the question bizarre, actually. I knew, though, I think my law background contributed to me recognizing the harm earlier than my peer doctor peers. Because in March, there's all this, controversy over hydroxychloroquine. But in April, I'm living in California, I got a letter from the governor, from the medical board, stating that if I were to prescribe hydroxychloroquine just for COVID, it's a threat to my license. And I went to all my doctor peers and I said, aren't you concerned about this, that there's a bureaucrat somewhere in Sacramento that is telling you how to practice medicine? Don't you find this concerning? This has never happened in the history of medicine. This is an FDA-approved medicine. And by the way, they're not even making the pretense it's not safe. They're saying you can't prescribe it for COVID, but have at it for lupus or rheumatoid arthritis or malaria. This I knew was a problem, so I started speaking out, and I publicly said, we have a medical issue, but we have a legal crisis. And I threw my attentions towards the legal crisis.
I am not from your world, of course, but I am actually a little bit surprised that you couldn't get more physicians that you worked with to at least acknowledge this is a really bad trend.
It's, for me personally, it's heartbreaking, actually.
What do you think, what is heartbreaking and also scary, since we all need health care, what do you think the motive was?
I think there's multiple motives. I think the milieu in which doctors are practicing is as employees. So like other Americans, they follow their paycheck. I think, so I try not to be too harsh to doctors because most Americans didn't buck the system. But we're also trained in medical school to just kind of regurgitate and to follow and regurgitate. And I do think in looking back, we have self-selected in the medical training process for people who will comply. That is very scary stuff.
Yes.
Very scary.
And it's antithetical to the whole
Correct.
profession, right?
Very scary. There were things we didn't learn and we were told not to question or to learn and you just moved on. And I think we selected for that.
How do you think the system selects for compliance?
Oh my goodness. I mean, you're rewarded for going along with the group. Very much follow the herd, very much so. Yeah, you're punished very heavily if you step out of line.
Was that true when you were in medical school?
It's gotten where I think I'm exactly the right age to have come to this moment because my father's a doctor and I saw medicine as a child. It was nothing like this. And even in medical school, it wasn't like this. Residency was a little bit more like this, and I would say in the last 20 years of full practice, it was moving inexorably to lockstep. We were given protocols. We were told we had to follow protocols when a patient came in. So for years I'd be fighting. A patient would come in with a fever, for example. I was under so much pressure to give every patient with a fever an antibiotic. Never mind if they were, outdoors and they, it was heat exhaustion, or never mind if they had an allergy like to something. If I didn't get an antibiotic into that person within an hour, I was reprimanded. So it became protocolized medicine. It became, just a checklist. And I was fighting that for a lot of years. And it was not like that when I started.
Well, that's scary.
Very scary.
Yeah, it is very scary. So